MyChild Card is designed to bring three values. The first value that it brings is to ensure that every child is registered, no matter if they are born at home or at the health center. The second value that it brings is that it reduces or eliminates unnecessary registration and reporting from the health workers, so that they can spend much more time taking care of children. The third value that it brings is that it enables reliable and relevant information that is given to the hands of decision makers, key actors, so that they can understand the gaps in the field and at the health center level and try to close those gaps. MyChild Card is given to the hands of parents or guardians, and they are the holders of this card. And through this card, we can follow up on every child's vaccination status, nutritional status, growth, development, from the time that they're born until the 5 years old. Each MyChild Card has unique ID connected to this card and is assigned to a newborn child. And this card has three sections. The first section is educational materials that are connected to parents, so that parents know how to take care of their children, their health, that they know the danger signs, immunization schedules, and when to come to the clinics, for instance. And in addition to that, they know how to prepare oral rehydration salt in case the child gets diarrhea, or any other information that is relevant for parents to know how to take proper care of their children. The second part of this card is meant to be for nurses, so that they can register what preventive health services that they're giving to every child. For instance, the date when the vaccines are given, the weight of the child, and so on, so that they can follow up and track the whole history of the child within this card and input additional information that could be of relevance and importance. And the third section of the card includes the slips that are meant to be scanned and digitized. So the health worker ticks basically information such as like BCG that she has given, or any other services that she has given. Later, the filled-in slips are sent to the scanning station. At the scanning station, these slips are being digitized, and the information would be available in the database, which would create the electronic health record for each child. About 60 indicators today are generated and sent to the key actors, so that they understand the gaps and can close those gaps. With MyChild Card, we ensure that every child is registered, no matter where they live. And we ensure that health workers only register in one place, and it's enough. They can eliminate unnecessary forms and administrative work that they had to do previously. And the third is that the reliable information is generated to key actors at the community, district, and national level, so that based on that, they can close the gaps in preventive health service delivery.
At a click of a button, we can now have reliable data and plan that how many children were born in our area. And we believe using the system can help us to track children who miss out their doses.
Plan better for services, and plan better for supplies, and of course help us in birth registration, which has been a challenge in many areas in this country.
When we don't have power, let me say solar or electric power, this program can work.
It's easy to use, there's good data management, it's very fast to use. Mothers don't wait for so long in the queue.
For example, what I've learned from this group is ORS. I've not been knowing how to mix it myself. If we have this knowledge, really we can make it ourselves and it can help us. Maybe it is during the night and you can't run out to look for a medical personnel. If you have this message, really you can do it yourself.
It directs you how your kid can, the stages of the child development. It shows that your child should sleep under a mosquito net. Even it talks about how a child can be treated when she has got diarrhea.
Nekirala kya mugaso nnyo okusula mu katimba ekira okugemesa omwana kirungi nnyo ku bulamu bw'omwana.
Most importantly, MyChild Card can be immediately implemented in different parts of the world, scaled in places without electricity in rural areas, scaled in places which doesn't have security or connectivity. So let's work together to bring this innovation to children all over the world.